All right, so what Danny's doing here is he's just taking a curvilinear 3 to 5 megahertz probe. He's aiming the indicator towards the head. He's placing it just under the xiphoid process, and then he's just sliding 1 to 2 centimeters to the patient's right. So that's the deal. Probe goes just under the xiphoid. Slide 1 to 2 centimeters to the patient's right, and you just tilt towards the heart. So let's go through the normal anatomy you'll then see on your ultrasound screen. So what you see is, you see a IVC, the black thin-walled structure underneath the liver, and you're getting just a cut of the heart, the right atrium. And that's key. That's the proper position when you have just a little bit of the heart there. All right. Now you see that arrow? That's measuring 1 centimeter past the hepatic vein towards the patient's feet. That's where you want to look at the IVC. If you can't see that, then you just go about 2 to 3 centimeters from the heart border. This IVC is collapsing nearly completely, but anything greater than 50% is a patient who's going to be responsive to fluid. So that's been the most validated number. If the IVC collapses more than 50%, give them some fluid. I would tell you if it's greater than 30%, which is really what you could easily see with your eye, I would probably, in most cases, give them fluid. So if you're really seeing any significant collapse, then the patient needs fluid. All right, we gave that patient 4 liters of fluid. Look at the IVC now. No respiratory collapse. If we look just past the hepatic vein, that IVC is not collapsing with respiration. It's staying pretty much identically sized throughout the respiration cycle. This patient doesn't need fluid.